Dr. Kyle with Columbia River Chiropractic, bringing you your next tip for Tuesday. Today we're going to cover a subject that I have entitled the glitch. It's something we see very often in our clinic, but I wanted to get down to the basics and the ultimate root of what the glitch is and why it affects so many of us out there and how it can be such a significant reoccurring health issue that many people struggle with. So one thing to understand right off the bat, our spine is not one bone. It's actually 24 bones all stacked on top of each other. And this is kind of a beauty of our spine, or of our body in general, because what this enables is we have a lot of motion and a lot of stability to protect the important things that are inside our spinal column, like our spinal cord, and then obviously up here in our skull and our brain. So this balance of stability versus mobility is very important as far as maintaining that throughout our entire spine. Because if you were to start off with your very bottom vertebrae, your L5 vertebra, cause an issue there, it could potentially make its way up each vertebrae all the way to the top, in theory. Now, one thing that affects everyone's spine, and an important thing for all of you to understand watching, is we have what we refer to as hypermobility and hypomobility. Hyper meaning something is moving too much, hypo meaning it's not moving enough. This is a constant fluctuation that our spine has to deal with based on movements, based on repetitive patterns, based on poor posture that we have throughout our day. And what happens very often is when we get to, we'll say poor posture is a good example, of a spot in different areas of our spine will take additional stress and they will tend to become fixated and stuck, that whole hypomobile thing. So what happens is you take a stuck vertebra like that and the vertebra above and below have to move even more to make up for that lack of motion, especially if we're talking about keeping this fluid mobility throughout our entire spine. Now, you have to remember, our brain is ultimately what controls all of our movements. So if our brain is trying to use hardware that's become faulty, over the course of time, we have potential for it to have a glitch or not be able to have as good of control over this mobility and stability that we're trying to work with. The significant part of this hypomobility and hypermobility means that you start to have the muscles around your spine. So picture this as a muscle that kind of goes up the length of your spine. And say you make a movement where you bend to the side and maybe twist a little bit. If you have a vertebra that's stuck somewhere in the middle where that muscle would be, it means the vertebra on either end of it have to stretch that muscle even more. And so then when your brain goes back to more of a neutral position away from that position that you just bent, it has to make sure that those muscles that just stretched have to go back in a smooth, coordinated fashion. Now you can do this 99 times out of 100, 999 times out of 1,000, but there's that one time that your brain has to have just exact coordination over that motion that it has a glitch. It doesn't sync up quite right. And what happens there, we think, is that the muscle stays stretched out quicker or longer than it's supposed to be, and it allows a bone to shift. And when that bone shifts, it puts pressure on very pain-sensitive structures like our nerves that come off our spine. And you can see these are some of our discs in here. And then what are even more pain-sensitive that many people don't give cadence to are what are called our facet joints. And that's where each bone of the vertebra above and below line up with the one above. And you can see just from this motion, they're supposed to open and close and bend and open based on the directions we go. So during this glitch potential that you may have, if you have a stuck vertebra that's basically setting you up for the big one, this is what ends up causing people to end up in our clinic where they have thrown their back out. So to make this very practical for you guys, say something falls on the ground, you've done this 99 times out of 100, that 100th time you bend over to pick up improperly, you cause a little bit of a twist, and when you come up, that muscle doesn't quite sync up right, that bone shifts, and I'm stuck. I feel like I'm gonna buckle my knees and fall down to the ground. So again, very simple concept in understanding that these different bones are supposed to move relative to each other in this fluid, smooth balance, and when they don't, when you have one of these 24 vertebrae that gets stuck, it basically sets you up for potentially debilitating back pain. The reason I bring this up is because we see this almost every day in our clinic, And the majority of people that come in with really acute back pain is not from them lifting something really heavy or doing something where they exert themselves very much. It's literally something that they do all day, every day. Taking shoes off, putting them on, picking children up off the floor, bending over to pick something off the floor. We see it time and time again. So the more you understand this concept, I think it goes a long way as far as you being able to better take care of your spine and making sure that you are doing a good job keeping mobility and stability balanced in your spine. Now this is where chiropractors come into play, because our job is to find those vertebrae that are stuck or they're hypermobile and make sure that they're moving better, so the fluidity with your spine can be much more simple, and that way not only do you recover from injuries quicker, but you're less predisposed to spinal injuries as a result. And then, as many people know that have experienced chiropractic benefits, there's a lot of other health components that deal with this entire complex of our body. So this is a simple concept that I wanted to break down in depth because I really want you guys to understand this. And again, I think this can make a big difference as far as your overall health is concerned. Hopefully this makes sense. If you guys have any more questions, don't hesitate to reach out to us. I'm Dr. Kyle, Columbia River Chiropractic. Thanks for watching.